Good morning, good morning, good morning. Happy Monday. This beautiful day, the 25th of July, 2022. Let's begin with training. Let's just check here what's happening. I hope today the network will be better than last week. Last week was a mess. Let's see. Okay, let me do this. And that one. Okay. Good morning, great leaders. Good morning, good morning. Monday night, 7 o'clock. Today we are doing hepatitis. I hope everyone is well. How are you? Are you excited? We are discussing about the liver, an organ that we all have. Ne? I'm trying to see now with my phone. What's happening? Good morning. Good morning, Osria. Good morning, leadership. Right? You know these things. Can we pretty please share the training link with our respective groups? Last week I forgot to share with so many groups, but luckily there are leaders who could share the link, Yeah, my word. Last week was just a disaster. Yeah, so hopefully this week it's sorted because I did ask my service provider of the Wi-Fi to come and see what's the issue. So let's hope that today there won't be any glitches. Welcome, Leader Matip. Welcome, great leader. We will start in a minute. So it's 1908, 1909, 1910. We are only talking about the liver today. There's something wrong. I think I need to log out then of Facebook. Something is wrong with my phone. Okay, let me just restart. While we wait. I hope I'm audible. You can hear me, right? I hope you can hear me. So today it's okay, it's 1909. Wonderful leaders, thank you so much for attending training on this beautiful day, the 25th of July 2022. So we're talking about hepatitis. The reason being on the 28th, it is World Hepatitis Day, right? So, you can hear me. Wonderful. Thank goodness. Yeah, because I tried to do testing, but yeah. So great leaders. Does anybody know of anyone with hepatitis? I guess there's what, 5 kinds? Hepatitis A, B, C, D, E. You don't have to say if it's you. It's not a problem. We do respect privacy, but do you know about hepatitis? Yeah, actually, let me rephrase. Do you know about hepatitis? Let's start there. As a language distributor, do you know about hepatitis? Good morning, Sir Richard. Good morning, good morning. See, today I showed up in my natural self. Today there was no time. There was no time. I'm my natural self today. So great leaders. Okay, so now we're going to find out why hygiene and sanitation and water, clean water, is important. All right, very very well linked with hepatitis. All right, the sanitation, hygiene, and water. All right, you'll soon find out. So, great leaders, what I'm going to do, let me just see if I can now connect with my phone because I do need to, because I'm gonna go out of this training and connect and just check your comments with my phone. Hey, but sometimes this phone it does its own thing. Your live comments come here whilst I'm training. So let's see. I think we're good to go now. Okay. All right. Okay, we're good to go now. You don't have to say. Okay, wonderful, wonderful. Okay, so great leaders, on this beautiful Monday evening, even if I will say good morning, we are discussing hepatitis. And I'm repeating myself, it's because 25, 26, 27, 20. So 3 days from today, let's say tonight, it is World Hepatitis Day. Okay. Now, with hepatitis, I'm going to do just a couple of steps for you. Please write them down. I get it. This is training. We always have our stuff handy. I get where we write our stuff. So with hepatitis, more than 350 million people live with viral hepatitis. More than 350 million people worldwide. And then 9 out of 10 of people living with hepatitis are unaware of their diagnosis. 9 out of 10. It's like they should have just say all of them. Yeah? Um, so yeah, this is quite alarming, and someone actually dies from hepatitis every 30 seconds. Every 30 seconds. Welcome, Leader Tito, Vivian. Welcome, my personal person. So this is actually quite a serious ailment. So let me just share the screen and then let us discuss. Did I press the right thing here now? Okay, I did. Right. So today, no videos. Today I'm just reading. Uh, I hope my voice is not monotonous. I'll try to keep it interesting. Let's have a look. Is this the page? Yeah, that's the page I'm looking for. Okay, so I'm reading directly from www.worldhepatitisday.org. All right, so there is a whole page dedicated to this movement, all right, of Hepatitis Day. Now, as you can see right at the top left, World Hepatitis Day, 28 July, brought to you by World Hepatitis Alliance. So this is actually quite serious. So now, I'm repeating myself here, with a person dying every 30 seconds from a hepatitis-related illness, we cannot wait to act on viral hepatitis. All right? People living with viral hepatitis, unaware, can't wait for testing. You can't wait for testing because there is a very good chance that you might end up worse. People living with hepatitis cannot wait for life-saving treatments. Expectant mothers cannot wait for hepatitis screening and treatment. Newborn babies cannot wait for birth dose vaccination. People affected by hepatitis cannot wait to end stigma and discrimination. Welcome, Leader Happy and Leader Azinwi. Welcome, great leaders. Community organizations cannot wait for greater investment, and decision makers cannot wait and must act now to make hepatitis elimination a reality through political will and funding. All right. So the reason why I say cannot, I don't like can't. Uh, I had like the best teachers in high school. Okay, so in J, I was taught by like proper English teachers. I don't do the can't. We speak proper. Okay. So, but unfortunately, they say I can't wait. It sounds better than I cannot wait, I suppose. So, I Can't Wait is a new campaign theme to launch World Hepatitis Day 2022. Welcome, Piers Karim. It will highlight the need to accelerate the fight against viral hepatitis and the more importance of testing and treatment for the real people who need it. The campaign will amplify the voices of people affected by viral hepatitis, calling for immediate action and the end of stigma and discrimination. Stigma and discrimination. Let's continue. Hepatitis can affect anyone, but it has a disproportionate effect on the people and communities most underserved by health systems. I repeat, right there at the top in the blue, that's where I'm reading, okay? Hepatitis can affect anyone, but it has a disproportionate effect on the people and communities most underserved by health systems. This is where me and you come in. And there's the stats that are going through. See that red, they're going. There's a 350 million, more than 350 million people live with viral hepatitis. 9 in 10 people living with hepatitis are unaware of their diagnosis. All right, let's go to the important stuff. What is this hepatitis? What are we talking about? So I said there's 5 types: A, B, C, D, E. Different types of viral hepatitis. So they are all viruses. Number one, highlight that in your mind. They're all viruses. Number one. Now, what is hepatitis A? It has a vaccine. It also has treatment, and most people make a full recovery. All right, so it is curable. Now, hepatitis A is an inflammation of the liver caused by the hepatitis A virus, otherwise known as HIV or HIV. The virus is primarily spread when an uninfected and unvaccinated person ingests food or water that is contaminated with the feces of an infected person. Just listen to that. The disease is closely associated with unsafe water or food, inadequate sanitation, poor personal hygiene, and oral anal sex. So now you see when we started, I said, now we're going to see why proper hygiene, sanitation, and clean drinking water is so important. All right, just link. Let's just link. All right, second paragraph. Unlike hepatitis B and C, hepatitis A does not cause chronic liver disease, but it can cause debilitating symptoms and rarely fulminant hepatitis. Fulminant hepatitis is an acute liver failure, which is often fatal. WHO estimates that in 2016, over 7,000 persons died from hepatitis A worldwide, accounting for about 0.5% of the mortality due to viral hepatitis. Welcome, great leaders, Leader Veronica, Leader Todiswa. All right, moving on. Hepatitis A is common in low and middle income countries. Our customers, leaders. Hepatitis A is common in low and middle income countries with poor sanitary conditions and hygienic practices. Infection rates are low in high income countries, of course, with good sanitary and hygienic conditions. Disease may occur among adolescents and adults in high risk groups, such as persons who inject drugs, all right, or men who have sex with other men, or people traveling to areas of high endemicity, and in isolated populations, such as closed religious groups. Our customers, leaders, closed religious groups. I can think of 3 closed religious groups off the top of my tongue. In the United States of America, Sir Richard, large outbreaks have been reported among persons experiencing homelessness. So the homeless, obvious, there's no sanitation. It's just, it's not hygienic. Symptoms of hepatitis A range from mild to severe and can include fever, malaise, this word. So malaise is a general feeling of you feel off all the time. You just feel off. You don't feel yourself. You feel sick. All right, that's malaise. Loss of appetite, diarrhea, nausea, abdominal discomfort. So our customers that keep on coming and say, "Yo, my abdomen is so sore," we need to also ask leading questions. Do you have any disorder? Maybe with the liver, maybe, Dark colored urine is also one of the what am I reading? One of the symptoms, all right? Dark colored urine and jaundice, which is a yellowing of the eyes and skin. Not everyone who's infected will have all the symptoms. All right. Hepatitis A sometimes relapses, meaning the person who just recovered falls sick again with another acute episode. This is normally followed by recovery. You can't win. Well, unless if you're a Longlish member, you can win. There is no specific treatment for hepatitis A. Point number 1. Recovery from symptoms following infection may be slow and can take several weeks or months. Improved sanitation, food safety, and immunization are the most effective ways to combat hepatitis A. Now, the spread of hepatitis A can be reduced by the following. Number one, there's only 3 points, so it's easy. Adequate supplies of safe drinking water. You see why hygiene and sanitation is so important. So the spread of hepatitis A can be reduced by number one, adequate supplies of safe drinking water. Number two, proper disposal of sewage within communities. You see why we pay rates and taxes for people to come and take our dustbins, for them to serve as infrastructure, which they're supposed to be doing. But yeah, we know the story, né? In South Africa. And then the third one, personal hygiene practices such as regular hand washing before meals and after going to the bathroom. So you're doing it to save yourself from potentially developing hepatitis A. Now, hepatitis B. Yes, it has a vaccine. Yes, it has treatment, but a cure is in development. So the cure is not here yet. All right. So hepatitis B is a potentially life-threatening liver infection caused. So this one is a life-threatening liver infection, hepatitis B, caused by the hepatitis B virus, otherwise known as HBV. It is a major global health problem. It can cause chronic infection and puts people at high risk of death from cirrhosis and liver cancer. So cirrhosis is what? Scarring of the liver, right? A safe and effective vaccine that offers 98 to 100% protection against hepatitis B is available. Preventing hepatitis B infection averts the development of complications, including chronic disease and liver cancer. Please take note of hepatitis B. It will make sense as I go to the other ones. All right. The burden of hepatitis B infection is highest in the World Health Organization, Western Pacific region. I don't know if you've got customers there, and the WHO African region, where 116 million and 81 million people, respectively, are chronically infected. 16 million people are infected in the WHO Eastern Mediterranean region, 18 million in the WHO Southeast Asia region, 14 million in the WHO European region, and 5 million in the WHO region of the Americas. I'm reading this because this is stats. Maybe we've got leaders in Southeast Asia. We should have, but I don't know if they watched this training. Welcome, Leader Flourish, in the Mediterranean region. There's your customers. Hepatitis B is most commonly spread from mother to child at birth, which is called perinatal transmission, or through horizontal transmission, which is exposure to infected blood. The development of chronic infection is common in infants infected from their mothers or before the age of 5 years. Welcome, Leader Tina. Hepatitis B is also spread by needle stick injury, tattooing. So the leaders who love tattoos, hey, be a little bit careful now, ne? Piercing and exposure to infected blood and body fluids, such as saliva and menstrual, vaginal, and seminal fluids. Welcome, Leader Amaifule. I hope I'm saying it right. welcome, great leader. Okay. Transmission of the virus may also occur through the reuse of contaminated needles and syringes or sharp objects, either in healthcare settings, in the community, or among persons who inject drugs. Sexual transmission is more prevalent in unvaccinated persons with multiple sexual partners. So those who are promiscuous also high risk for developing hepatitis B. All right. Most people do not experience any symptoms when newly infected. However, some people have acute illness with symptoms that last several weeks, including yellowing of the skin and the eyes, which is jaundice, dark urine. So have a look at your urine. I always tell leaders, please have, I know it sounds gross, but the color of your urine and the color of your number two, your feces, is the way your body communicates to you. All right. The body talks. All right. So dark urine, extreme fatigue, nausea, vomiting, and abdominal pain. People with acute hepatitis can develop acute liver failure, which can lead to death. Let me highlight that there. People with acute hepatitis can develop acute liver failure, which can lead to death. Among the long-term complications of HBV infections, a subset of persons develops advanced liver diseases such as cirrhosis and let me do this, and hepatocellular carcinoma, which cause high morbidity and mortality. Now, hey, you know what? This medical English, guys, I still have to get used to this. Hepatocellular carcinoma is the most common form of liver cancer, often seen in people with chronic liver diseases like cirrhosis, and it's more common in people who are above the age of 50 years of age. Okay, are we together? Okay, so as of 2019, over 30 million people were aware of the infection, while over 6 million of the people diagnosed were on treatment. So just listen to that. So of the 30 million plus, only 6 million plus were on treatment in 2019. This is according to the latest WHO estimates. The proportion of children under the age of 5 years chronically infected with HBV dropped to just under 1% in 2019, down from around 5% in the pre vaccine era, ranging from the 1980s to the early 2000s. Are we together, leaders? Chronic hepatitis B infection can be treated with medicines, including oral antiviral agents. Treatment can slow the progression of cirrhosis, reduce incidence of liver cancer, and improve long-term survival. Now, in 2021, WHO estimated that 2021 was last year, remember? So this is now. So in 2021, WHO estimated that 12% to 25% of people with chronic hepatitis B infection will require treatment, depending on setting and eligibility criteria. WHO recommends that all infants receive the hepatitis B vaccine as soon as possible after birth, preferably within the 24-hour window period, followed by 2 or 3 doses of hepatitis B vaccine at least 4 weeks apart to complete the vaccination series. Protection lasts at least 20 years and is probably lifelong. WHO does not recommend booster vaccinations for persons who have completed the 3-dose vaccination schedule. Thank you, Leader Matip. In addition to infant vaccination, WHO recommends the use of antiviral prophylaxis for the prevention of hepatitis B transmission from mother to child. You see why it's so important for mothers, pregnant women, to go for the antenatal classes. All right. Implementation of blood safety strategies and safer sex practices. Remember, sex is also a factor here, including minimizing the number of partners and meaning number of partners that you have sex with, and using barrier protective measures, which is like condoms. Hello, Longridge now has swelling joy condoms, eh? Also protect against transmission. No, I love Longridge. We even have condoms. So leaders, let's sell those condoms. Swirling joy. Hepatitis C. It does not have, welcome Leader Hamim. It does not have a vaccine, hepatitis C. It is treatable and it is curable. Now, hepatitis C, also known as HCV, causes both acute and chronic infection. You see how these are interrelated. It's like what you call it, a ripple effect. 70% of persons will develop chronic HCV infection. Of those with chronic HCV infection, the risk of cirrhosis ranges from 15 to 30% within a 20-year period. HCV occurs in all WHO regions. The highest burden of disease is in the Eastern Mediterranean region. I don't know if there's leaders who are from there, but yeah, you've got customers there. And European region. Europe, is there a leader from Europe in here? You've got customers with 12 million people chronically infected in each region. Hey, that's a lot. In the Southeast Asia region and the Western Pacific region, an estimated 10 million people in each region are chronically infected. 9 million people are chronically infected in the African region and 5 million the regions of the Americas. Ah, we've got customers. We've got customers. Lida, maybe you're missing me. Don't you have you still have my number, most leadership? Send me a WhatsApp. I don't have your number anymore. Remember, my phone crashed in March, so I lost so many people's numbers. The hepatitis C virus is a blood-borne virus. It is most commonly transmitted through the following: the reuse or inadequate sterilization of medical equipment, especially syringes and needles in healthcare settings, hospitals, clinics, right? Number two, the other most commonly transmitted way is through the transfusion of unscreened blood and blood products, né? And then injecting drug use through the sharing of injection equipment. There's like drug addicts, those ones, they nyaupes. In South Africa, they know what I'm talking about when I say they nyaupes. They share injections. So, hey, leaders, now we can see that we need to broaden our scope when it comes to our clientele. Maybe we need to maybe we need to go door to door to the houses where we know that the child there is a nyaupe addict. All right, welcome to the Unalina. HCV can be passed from an infected mother to a baby and via sexual practices that lead to exposure to blood. For example, people with multiple sexual partners and among men who have sex with men. However, these modes of transmission are less common. Hepatitis C is not spread through breast milk, thank God. It's not spread through food or water or casual contact, such as hugging, kissing, and sharing food or drinks with an infected person. Remember, it's bloodborne. Those who are acutely symptomatic may exhibit fever, fatigue, decreased appetite, nausea, vomiting, abdominal pain, dark urine. Remember, I said our bodies communicate to us. You need to check the color of your urine after you do your number one. You need to check the color of your feces. Number two, welcome, leader Zainab. Welcome, great leader. All right, our bodies communicate to us. All right. So let me read again. Those who are acutely symptomatic may exhibit fever, fatigue, decreased appetite, nausea, vomiting, abdominal pain, dark urine, pale feces. So your feces is no longer brown now. Now it's like yellow. Yeah, pale feces, joint pain, and jaundice. All right, which is yellowing of skin and the whites of the eye. Because new HCV infections are usually asymptomatic, so they don't exhibit symptoms. They can't tell that they're sick. Few people are diagnosed when the infection is recent. In those people who go on to develop chronic HCV infection, the infection is often undiagnosed because it remains asymptomatic until decades after infection, when symptoms develop secondary to serious liver damage. I don't know. Am I communicating? Do you see that we've got so many customers just by reading that one sentence? Early diagnosis can prevent health problems that may result from infection and prevent transmission of the virus. Who recommends testing people who may be at increased risk of infection? About 2.3 million people of the estimated 3.7 million living with HIV globally have serological evidence of past or present HCV infection. Chronic liver disease represents a major cause of morbidity and mortality among persons living with HIV globally. So they are not mobile, and their lifespan is cut short by the HCV virus. All right. Let me just go on to this one of 58. Of the 58 million persons living with HCV infection globally in 2019, an estimated 21% knew their diagnosis. Imagine that's about 15.2 million people of the 58 million people. And of those diagnosed with chronic HCV infection, around 62% had been treated with this drug that WHO recommends, the DAA, by the end of 2019. which is called direct acting antivirals. The DAA stands for direct acting antivirals. There is no effective vaccine against hepatitis C. So prevention depends on reducing the risk of exposure to the virus in healthcare settings and in higher risk populations. These include people who inject drugs and men who have sex with men, particularly those infected with HIV or those who are taking pre-exposure prophylaxis against HIV. Now, primary prevention interventions recommended by WHO include number one, so there's six of them. Number one is safe and appropriate use of healthcare injections. Number two, safe handling and disposal of sharps and waste, provision of comprehensive harm reduction services to people who inject drugs, and then testing of donated blood for HPV and HCV, as well as HIV and syphilis, and then training of health personnel and prevention of exposure to blood during sex. Are we learning, great leaders? We're moving on to the other hepatitis. Second last one, hepatitis D. Where did this thing go now? Okay. Now, hepatitis D has no vaccine. Although hepatitis D only affects people living with hepatitis B, which there is a vaccine for. Remember when I was reading on hepatitis B, I said, please take note of hepatitis B. It will make sense later. This is the time. Treatment, there is no treatment. Cure, treatment, there is treatment. Cure, there is no cure for hepatitis D. Now, hepatitis D is an inflammation of the liver caused by the hepatitis B virus, also known as HDV, which requires HBV for its replication. Hepatitis D infection cannot occur in the absence of hepatitis B virus. So HBV co-infection is considered the most severe form of chronic viral hepatitis due to more rapid progression towards the hepatocellular carcinoma. Remember, I said it's the most common form of liver cancer and liver-related death. Vaccination against hepatitis B is the only method to prevent HDV infection. I repeat, vaccination against hepatitis B is the only method to prevent hepatitis D infection. It is estimated that hepatitis D virus affects nearly 5% of people globally who have chronic infection with hepatitis B virus, and that HDV co-infection could explain about 1 in 5 cases of liver diseases and liver cancer in people with HBV, the B form of hepatitis. The route of HDV transmission, like HBV, occurs through broken skin, so via injection and tattooing, etc. Take note of the tattooing partner, or through contact with infected blood or blood products. Transmission from mother to child is possible, but it's rare. Vaccination against HBV prevents HDV co-infection and hence expansion of childhood HPV immunization programs has resulted in a decline in hepatitis D incidence worldwide. Thank goodness for technology and advancements. Chronic HBV carriers are at risk of infection with HDV. People who are not immune to HBV, either by natural disease or immunization with the hepatitis V vaccine, are at risk of infection with HBV, which puts them at risk of HDV infection. You see how this is a ripple effect? Those who are more likely to have HBV and HDV co-infection include the following indigenous people, people who inject drugs, and people with hepatitis C virus or HIV infection. The risk of co-infection also appears to be potentially high in recipients of hemodialysis, so blood dialysis, men who have sex with men, and commercial sex workers. So basically, they're saying prostitutes. That's what they're saying. In acute hepatitis, simultaneous infection with HBV and HDV can lead to a mild to severe hepatitis with signs and symptoms of indistinguishable from those of other types of acute viral hepatitis infections. These include the following: fever, fatigue, loss of appetite, nausea, vomiting, dark urine, pale colored stools, and jaundice, which is the yellowing of the eyes. HDV diagnostics are not widely available, and there's no standardization for HDV RNA assays, which are used for monitoring response to antiviral therapy. I hope I'm not depressing you, but I'm showing you that we actually do have a lot of customers. Let me just read the last two. More efforts are needed to reduce the global burden of chronic hepatitis B and develop medicines that are safe and effective against hepatitis D and are affordable enough to be deployed on a large scale to those who are most in need. While WHO, the World Health Organization, does not have specific recommendations on hepatitis D, prevention of HBV, the hepatitis B, transmission through hepatitis B immunization, including a timely birth dose, remember that 24-hour period, additional antiviral prophylaxis for eligible pregnant women, blood safety, safe injection practices in healthcare settings, and harm reduction services with clean needles and syringes are effective in preventing HDV transmission. Hepatitis B immunization does not provide protection against HDV for those already infected with HBV. Hey, I hope I'm not depressing you, ne? And then, great leaders, the last one, hepatitis E. It does not have a vaccine. It is treatable, yes, and most people make a full recovery. Now, hepatitis E is inflammation of the liver caused by the hepatitis E virus. Now we call it HEV. The virus is shed in the stools of infected persons. So when they do the number two, that's what happens. Okay? When they do the number two, it's shed in the stools and enters the human body through the intestine. It is transmitted mainly through contaminated drinking water. The infection is usually self-limiting and resolves within 2 to 6 weeks. Occasionally, a serious disease known as fulminant hepatitis, which we spoke about earlier, otherwise known as acute liver failure, develops, which can be fatal. Hepatitis E infection is found worldwide and is common in low and middle income countries with limited access to essential water, sanitation, hygiene, and health services. In these areas, the disease occurs both as outbreaks and as sporadic cases. Right? The outbreaks usually follow periods of fecal contamination of drinking water supplies and may affect and may affect several hundred to several thousand persons. Some of these outbreaks have occurred in areas of conflict and humanitarian emergencies, such as war zones and camps for refugees, or internally displaced populations, where sanitation and safe water supply pose special challenges. Now, what are the typical signs and symptoms of hepatitis E? The last one. An initial phase of mild fever, reduced appetite, otherwise we can say anorexia. So reduced appetite and then, or anorexia, nausea and vomiting lasting a few days. Second, abdominal pain, itching, skin rash or joint pain. All right, and then jaundice, which is the yellowing color of the skin, dark urine, and pale stools. Pale stools. I mean, we all know the color of our number two. I guess. And then the last one, a slightly enlarged tender liver. A slightly enlarged tender liver. I hope we all know where our livers are. Ne? If you don't know, just check. I can't show. Yeah, but if you don't know, just check online where is the liver so that you become alert when you have pains in certain areas where you're not supposed to be having. You need to become more alert or more vigilant. All right. Diagnosis can often be strongly suspected in appropriate epidemiologic that word that word epidemiologic settings. For example, when several cases occur in localities in known disease endemic areas, in settings with risk of water contamination, when the disease is more severe in pregnant women, or if hepatitis A has been excluded. Hospitalization is generally not required. Most important is the avoidance of unnecessary medications. Hospitalization is required for people with the fulminant hepatitis and should also be considered for symptomatic pregnant women. Prevention is the most effective approach against the infection. At the population level, transmission of HIV and hepatitis E infection can be reduced by the following. Number one, maintaining quality standards for public water supplies. So because we know that water is a problem, we need to sell the alkaline backup like nobody's business in areas like these. Establishing, number two, establishing proper disposal systems for human feces. All right, that's why we need a proper sanitation and hygiene thing facilities. And then on an individual level, infection risk can be reduced by the following. Number one, maintaining hygienic practices, washing your hands, sanitizing with the long reach mosquito spray or our other sanitizers, and then avoiding consumption of water and ice of unknown purity. Ladies and gents, training is over. Would you like to know what are our products for hepatitis? How? That's why you're here, most. Of course, you want to know. Okay, so we've got now. This was not done by me. I joined Longlish and I found it here, ne? The diseases and prescription PDF. Now, oh, by the way, alcohol abuse is also one of the stuff that can cause liver failure. So don't abuse that alcohol. Ne, leaders, I tell you, we've got the health wine. Please drink it accordingly, according to directions. Don't gulp. So number one is berry oil. Okay, our beautiful berry oil is recommended for hepatitis. So I'm just saying in general, okay? Doesn't matter is it hepatitis A, B, C, D, E. All right? For liver health, the berry oil, okay? Sorry, the alkaline backup. Obvious, the alkaline backup. It cleans the water and it then packs it with nutrients. And it's antiviral as well. Remember, this is a virus. Remember, I said make that note that hepatitis is a viral infection. And then cordyceps militaris. Okay, so this one is for uh, those who are, with cordyceps. Remember, we need to be very careful because with cordyceps, the supplement, it thins the blood. So if someone is preparing for an op or comes from an op, this is not for them. Okay, because they'll be having problems when they operating. So just be very careful when you recommend this one. So if you're not sure, rather stick with the coffee rather. Okay, our cordyceps coffee is very good for the liver as well. And remember, the cordyceps coffee is good for anyone who is recovering from anything. And remember, one of the symptoms of hepatitis is what? That malaise, that word, malaise, which means that you just generally, you don't feel well. You just feel ill, but you don't know why. All right? Malaise. And then obviously, any one of our teas are antiviral as well. Any one of our teas. But remember, with a thin person, stay away from pink tea, not for underweight people, okay? So rather the brown tea, the green tea, and remember the brown tea, we know the brown tea as the liver tea. Okay, but all of our teas are good for the liver. Besides this one being that we call it the liver tea. Yes, it reduces liver fat, it minimizes liver fat. But all of the long reach teas are very good for the liver. Ladies and gents, are there any questions? Training is over. Are there any questions, great leaders, regarding tonight's training? Should we call it a night? I hope you are inspired to do more. Hepatitis is really a serious disease disorder. You saw the stats. Every 30 seconds, someone dies from liver from I myself from hepatitis. Every 30 seconds globally. Every 30 seconds. So this is far worse than the cervical cancer. Okay, so hepatitis is actually, that's why there's a whole day dedicated, a whole hepatitis day, which is when Thursday on the 28th of July. All right, so great leaders, Are there any questions? Are there any questions? Is there somewhere where you're not clear that I try to clear it up? Otherwise, we can call it a night. Next week, grade leaders, I don't think they will be training. Yeah, because this weekend is just too hectic for me. Yeah, this weekend is just too much. So I don't think Monday I'll be able to do the training. All right. If I am, it will be by God's grace. Are there any questions, grade leaders? Can we call it a night? Uh, so it's 19:52. Oh, we're on 45 minutes. So I'll give it 4 or 5 minutes, then we can wrap it up. Are you clear now as to now? Okay, now you've got customers. Everyone is your customer. You saw hepatitis can start from zero. You can read my letter. Zipo. It's not working, this thing. Pato Mamdi. Leaders, can you hear me? Oh, okay, I'm back. Oh, yeah, the devil is a liar. Fire! I thought that these earphones are the ones, are these ones, and I don't know where these ones come from. So great. We still have a lot of time. We'll give it 2 minutes. Do you have any questions, great leaders? You see, we roll with the punches. The things we deal with. Do you have any questions, great leaders? I hope now we go sell those teas. You saw the liver hepatitis can affect anyone, and over 350 million people live with the viral hepatitis. And remember, there's 5 kinds, right? Hepatitis A, B, C, D, E. And remember, with the B, be very careful because it can give you D, and then it's now they're friends. Now it's a marriage now. So we don't want anybody having hepatitis B as well. So my leaders, please sell the teas like crazy. Our teas are antiviral. Okay. Remember, hepatitis is a virus. When I know you sell them like they are cupcakes. Sell those teas. Sell those teas. And remember, the nice part is that our teas are individually wrapped. So that's how also, well, most of us now, we sell the teas loose. No cross-contamination. Individually wrapped. What more do you want? Be a product of your products. Drink your teas. Drink your teas. Put in fruit pieces. And the nice part is that our teas are also good for respiratory infections. Where are we now? We're in the era of COVID. We're in the era of flu, pneumonias, of funny things. So you need to have the long teas as well. Of course, I'll never forget the alkaline pie cup. I've told everyone to get the alkaline pie cup. If you do not have the pie cup, I don't know, you haven't been attending my trainings. Or on the cordyceps capsules, do you mean regarding leadership, Leader Matip? Are you saying regarding what I was saying earlier? When I said when I said be very careful with the cordyceps. Remember, I said the cordyceps militaris is a blood thinner, a natural blood thinner. Yes, it's an antibiotic. It's great. Yeah, this product is great. But you need to be very careful. It's not for everyone. Like those who are preparing for a surgery or who come from a surgery. Okay, because it thins the blood. It's gonna be very difficult for the doctors to work on them. And then it's also not for people with heart disease. Generally, people with a heart condition are already on a blood thinner. So they are on blood thinner, and then you recommend another blood thinner. You're gonna have problems. Okay, so this is for anyone can take it. Okay, provided that they're not due for an op, they're not coming from an op, they still need to heal. And yeah, so this is a very good antibiotic. This is a powerhouse. Cordyceps black ginger, the same leadership. Remember, it's cordyceps. Okay, the cordycepin. Same story. As long as it's well, except for the coffee. Okay, the coffee is not as potent. So rather recommend this, okay? For safety, if a person is a high-risk patient, okay, or high-risk prospect, however you want to call them, rather recommend the cordyceps coffee. Was that clear, Leader Matip? So please, for people with heart conditions, be very careful. That's why I always say ask the leading questions, because funny enough, I mean, we not a lot of people don't think to tell like to be forthcoming. We need to dig those answers. You know, when a person comes to you with a problem, you need to have those disqualifying or qualifying questions. So you need to ask them, do you have any disorder? They're coming to you, they're telling you about abdominal pain. You saw it's one of the symptoms for hepatitis, abdominal pain. You ask them, do you have maybe a liver problem or any other disorder? And then they're like, oh yeah, man, you know, I do have it. You see, people don't think to speak. That's why me and you, we are here. All right, so we need to recommend responsibly so. All right, we need to recommend responsibly so. Yeah, the cordyceps militaris, it's not for everyone. Yeah, heart. If someone has a heart condition, they're on blood thinners, cut. We don't recommend. If they are preparing for an operation, you don't recommend. If they come from an operation, you don't recommend. Rather go for berry oil. Okay, or the coffee, because the coffee is very good for anyone who's recovering from anything. Okay, and then for remember that our products, here's another thing. um our products are all immune boosters. So for people who have autoimmune disorders, it gets tricky. Okay, why I say that? Because if it's an autoimmune disease, it means the body attacks itself. The stronger the immune system, the body will get stronger in attacking itself. Okay, so like people with rheumatoid arthritis, people with lupus, those are autoimmune diseases. Pike up. Okay, I recommend the pike up. I hope I was clear. Today it didn't. Hey, my service provider outdid themselves. I'm gonna send them a nice email now, because every Monday it was an issue. So leaders, autoimmune diseases, please, alkaline pack up. Okay, why? Because autoimmune disease means the stronger the immune system, the body attacks itself. So please, no green tea, no any tea, no berry oil, no, just the alkaline pie cup for people with autoimmune diseases. I hope I was clear, my leaders, ne? I hope you enjoyed the lesson. I'm not sure about next week, Monday. I've already, if you don't see, I've already said that there's probably a good chance that there's a 50-50 chance that I probably won't be here. There's just too much for me to do next week. All right. So thank you so much, great leaders. We'll see each other when we see each other. Eh? Now I'm being black. See you when I see you. You'll see me when you see me. So, great leaders, thank you so much. Let's take the products to the people. We definitely do have a business case. Do your maintenance, do your upgrades, get the teas, sell them individually. You actually even make more money when you sell the teas individually. Even the pads, you make more money when you sell them individually. Just practice hygiene. Eh? You don't just take it out with your hand. Just have some pizzazz, some class. You know, wear those gloves. Your prospects need to see that hey man, you are within, that you love yourself, that you practice good hygiene. Those are the things. It might look like it's too much for you, but I'm telling you, people are going to really appreciate you more, because it means you don't want to you're looking after yourself, and you're looking after them in the first place. And get the sanitizer, by the way, especially when you're selling the teas loose. When you're selling anything of ours loose, make sure that you buy the sanitizer, right? Thank you, Coach Z. You buy the sanitizer. You sanitize in front of them. You sanitize their hands. You can sanitize them, and then you are wearing your nice gloves, or maybe you've got the picker. You want to be fancy. Some of you really love to be fancy, so you take it out, and you take it out with a picker and give it to them. It sounds stupid, but I'm telling you, it works. So thank you so much, great leaders. We'll meet. I'm not sure about next week, but yeah, we'll see. Good night.